Department. The first thing I want to do is talk a little bit about case numbers. Statewide and in Cole County, we're still seeing a slight downtrend in case numbers. Our positivity rate has been decreasing, and we're very happy to see that. The main reason we wanted to have this press briefing today was to talk about the announcement that came last week and some guidance we received from Missouri Department of Health and Senior Services this week about booster doses. So I know that each healthcare organization is going to talk about the availability of those booster doses at their clinics, and we also want to talk a little bit about flu shots as well. So the first update I wanted to give was for the Cole County Health Department. And, each fall, the Cole County Health Department staff goes into the schools and some local businesses to do flu shot clinics. And this month, and the first part of November, so for October and November, we have over 40 off-site flu clinics scheduled at businesses and schools. So because of that commitment of our staff to go in and do those flu shot clinics, we won't be able to offer COVID vaccinations here at the health department in October. But thankfully, there are ample resources in our county to be able to offer those COVID shots for those who are needing the boosters. And we would encourage you to visit one of your healthcare organizations or a local pharmacy to get that COVID booster shot, or to go ahead and get your initial dose of the COVID vaccine. The Community Health Center is not able to be on today, Dr. Sullivan, so I wanted to let everyone know that they still have testing and vaccines available at their location. I did send out the graphic that had those dates and times on it, but I will reiterate that their Christie Drive location is open from 7 a.m. to 7 p.m. for testing and vaccinations. And they also have locations in Lynn, in California, and Fulton that are open from 8 to 5. So there's ample resources there if you need your COVID vaccination or have a question about testing. I also wanted to let you know that there's going to be 2 free testing events coming up in Cole County. I think they were also sent out in the email October 10th and October 24th. So those flyers were sent out this morning, but if you have questions, please let me know. So we'll proceed with Dr. Haight from Capital Region Medical Center.
Hello, everyone. As Christy said, our numbers are going down in this region and in Cole County. This morning, we had 6 patients that are COVID positive under isolation and 2 patients that are now out of isolation. With respect to the booster shots, we want to remind everyone this relates only to the Pfizer vaccine and not to the Moderna nor the Johnson & Johnson. And it also pertains to those who have received the Pfizer more than 6 months ago. According to the CDC statement, those that are recommended to have a booster are people 65 and older, and those in long-term care settings, they should receive a booster if they had the Pfizer. People who are aged 50 to 64 with underlying medical conditions should receive a booster if they had the Pfizer more than 6 months ago. And then those who are 18 to 49 years old who have an underlying medical condition, they may receive a booster. And so those are the people that were recommended. Again, it does not go under the age of 18 at this time, and so that's what we're looking for. You can go to the CDC website to look at what medical conditions they recommend, and it is similar to when we started out the vaccines in January and February for the high-risk patients. But again, you can go to the CDC website to look at those with medical conditions. At Capital Region, we are giving vaccines in our clinic. So our clinic system is able to get that, and we are continuing to make plans to have a smaller, larger event at our facility. But again, we're seeing a lot of our patients just come through our normal clinic flow. A question I am often asked, can you get your COVID shot at the same time you come in for your flu shot? And the answer is yes. As long as both are available, they would be able to receive both of those vaccines together. it is really dependent on what the patient would like to have done. So if there's any questions, I'm happy to answer any questions you might have.
Thank you, Dr. Haight. Dr. Adams from SSM St. Mary's.
Good afternoon. Thank you for having us. Similar to Capital Region Hospital, St. Mary's is also experiencing lower volumes of COVID admissions at this time. We currently have 10 patients admitted for the treatment of COVID. We are also offering the Pfizer booster doses at our clinics with an appointment. In addition to the criteria that Dr. Haight previously mentioned, we are also offering it to people who have high-risk occupational exposures, as well as those who are residents of congregate living facilities. Also want to mention that if you are a business owner and you would like to get the flu shot brought to your location to get your employees vaccinated for the flu, you can contact our retail pharmacy or our Director of Business Development, Janet Enlow, and you can schedule to have one of our pharmacists come on site to your business to get your employees vaccinated at your convenience. So it's a really great option to get everybody vaccinated in a very efficient way and make it convenient for everyone. And that's all. Thank you, Christy.
Thank you, Dr. Adams. I also want to point out, I don't see Ron Rockwood from Jefferson City Medical Group on, but also in the flyer that was sent out, it shared that they also have vaccines and testing available at their location on Stadium Boulevard each day from 8 to 4:30. So really ample opportunity in Cole County to get your COVID vaccine vaccination or your flu shot, and if you have any questions, of course, contact your healthcare provider. So I do see that our EMS director, Eric Hoy, is on. Eric, would you like to make any comments today? Okay, so at this time, I would open it up for any questions if anyone has any questions about what was shared today.
Hi, Hannah Falcon with ABC 17. Do you have any comment on Jefferson City Schools lifting their mask requirement?
So this summer, we developed some protocols with the schools. We met with them each week, sometimes every other week, but we've had a very robust relationship with them over the last 18 months. And this summer, we worked with them to develop protocols for green, yellow, and red levels, depending on what was going on in the community and the schools. And this was prior to DESE and DHSS releasing their guidance. And so as we developed those guidelines, we wanted the schools to be able to move through restrictions depending on what was going on in the community and what was going on in their school based on local data. So we fully support the local districts having control over their schools. It is a local school board decision, and we support them moving through the protocols as the data supports. So the cases have been going down. Our schools have not been seeing many cases in the schools. They'll continue to look at each situation differently if they have positive cases. Thankfully, the cases have been low. So we support them moving through that rubric as the local data changes. And it's obvious that other parts of the country and the state are doing that. Otherwise, we wouldn't have, full capacity sporting events. So, we've even talked about hospitals, as they change their visitor policies depending on what's going on in the community. So we support the schools making changes to their requirements based on their local data.
And sorry, Christy, it's Chief Hoy. I had a sticky mute button there.
Oh, that's okay, Chief. I just wanted to give you the opportunity to offer any comments.
Yeah, no problem. From an EMS perspective, we continue to see a downward trend in our calls for service regarding COVID-related illnesses. So positive outlook from the field perspective. We would just like, again, to encourage the community to practice safe practices, keep themselves safe. We are seeing a high volume of calls for service in other areas. So keeping COVID-related responses in check really does help us do our job efficiently. So we would just ask that people continue to exercise, even though it seems like we are on a downward trend here.
Perfect. Thank you, Chief Hoy. Are there any other questions?
Hi, this is Jessica with KRCG. This one is for Dr. Adams and Dr. Haight. So just to kind of be clear, you guys aren't going to have any big like mass vaccination clinics for that third booster dose. It's just people will have to call their doctor or make an appointment at like a pharmacy to go get that booster.
So at Capital Region, we are in plans to have a smaller, larger event. So not like the 2,000 people all in one day, but a smaller event. And that will be posted on our Facebook when we have that more fully developed. But otherwise, and I'm sure Dr. Adams will concur, and as well as Ron at JCMG, we have a large number of patients just calling and scheduling and or getting them at their regular appointment at this time.
I agree with what Dr. Haight said. For SSM St. Mary's patients, please call your PCP to schedule your booster dose.
Ron, I see that you joined us. I did share the schedule for your testing and vaccines, but if there's any other comments you would like to make, we would welcome those.
We're happy to provide booster doses here. We've already had over 500 individuals receive their booster dose since Monday. So we're continuing to provide those to the community. We offer the 3 different types of availability. You can walk in from 8 to 4:30. You can call us directly 573-556-7745 to schedule, or online at jcmg.org/COVID. So we look forward to assisting you however we can.
Perfect. Are there any other questions at this time?
Hi, this is Jessica, and I have another quick follow-up question. Just kind of based on what Ron said, have you all been seeing kind of the same, well, maybe like the same demand for that booster shot like we did the first time when we had that first eligible group who was available to get that first dose?
Do you want to go first, Dr. Adams, or would you like?
Sure. Yeah, we'll take turns. I personally have not observed the frantic demand that we had during the first rollout when the vaccine was first available. I think right now it's a much more calm process and much more what you're accustomed to historically, just reaching out to your primary care doctor to get that shot, to get that vaccination.
Right, and I think we have to remember back to January, February, we as a community would maybe get 1,000 doses or 2,000 doses, and that's all we had to work with to spread not only in Cole County, but to other counties as well. Versus now we're in a very different environment because not only do all of us have ample supply, all of our county health departments are able to access that, and also many of our pharmacies have vaccine available as well. So the access to vaccine is so far different from what we had in January and February.
That's a great point.
Yeah, very true. Very true.
But I would agree, man. The enthusiasm, I think, is certainly there to receive the booster, but the availability is so much more widespread now that, it's not a concern that we've only got a limited supply to work with. And so people are more amicable to waiting a little bit longer if they need to, or if they want to walk in at a later point, they can do that. So
It's true.
And then have you guys like ordered more vaccine, or are you still kind of using up the supply you've already had?
We continue to order vaccine to make sure that we have enough on hand to supply not only Cole County, but Region F, which is a 13 county area in mid-Missouri.
Right. So again, just to remind everyone, Region F has been meeting since November of last year regarding the vaccine so that we are able to redistribute vaccine to each one of us as we need to. So that goes on behind the scenes all of the time.
That's right. Some of the other local health departments might not have the ultra cold freezers to hold the Pfizer for long term. So we do meet, weekly and redistribute vaccine amongst ourselves to make sure that everyone who needs vaccine has it and it's held at the proper temperatures, and we meet all of the safety protocols as well. So I see that Carrie Turgeon has joined us. We have been talking about, the increase in availability of vaccine and also our decrease in cases. So I don't know if you have any comments to offer for us today. And we do talk about people who should get their flu shot as well. So
appreciate everyone continuing to stay and just continuing to collaborate and listen to our trusted healthcare professionals with what is available. So thank you, and We just want to continue to do that and work together and get the word out and share this among your family and friends and coworkers as well. Thank you.
Thank you. So are there any other questions? Okay, hearing none, I would just remind everyone to check the healthcare organization's website if you have any questions about when clinics are available or any other questions about vaccine or testing, and contact us if you do have questions. So thank you all and have a great day.